There are lots of organizations that create the conditions for local public health. Think about it for a second. Hospitals, community health centers, physicians, housing agencies, economic and social welfare groups, developers, and loads of others in the public, private, nonprofit, and for-profit sectors. Consider community and private philanthropies, elected officials, visual, oral, and digital media, or schools, daycares, and universities, not to mention numerous state and federal governmental organizations. There isn't a national health department in the US. There are many. People on their own and collectively, for better or worse, intentionally or not, create the conditions for their own health. But local governmental health departments or local health departments are the only local organization with the legal responsibility and authority to protect and improve a community's health status and to assure and promote the health of all residents in their political jurisdiction. So, why is NACCHO important? Because it distinguishes local health departments from other local organizations, and as a result, focuses its activities on those useful to local health departments. NACCHO develops and offers financial resources and developmental services for the range of local health department jurisdictions, whether they're a city, county, multi-county, urban, rural, suburban, state, or locally administered. And NACCHO provides an ever-changing and diverse set of resources and relationships for staff of local health departments. It offers multimedia, peer-to-peer networking, advisory skill development, and training opportunities for local health department staff. It offers national conferences, phone conferences and Zoom calls, small group topical meetings, print and digital media like NACCHO Exchange, coordinates messaging to Congress and the executive branches of federal government about local health department needs and priorities. There's no other organization that advocates exclusively for local health departments with Congress, federal departments, and the White House. For sure, continued emphasis on policy priorities of and funding for local governmental health departments. Regular advocacy directed at members of Congress and the executive branch, with emphasis changing over time based upon local health department priorities. Additional partnerships with federal government and philanthropic bureaucracies. Perceived excellent value for membership dues paid. Continued skill and success organizing, championing, and partnering with others to improve the public's health. Continued encouragement to develop relationships with elected state and federal officials back at home. Coordinated national messaging informed by local experience, local relevance, and of course, science. And the same political success achieved with Congress as modeled over time by community health centers. Continued opportunities for members to meet and learn from others' successes and failures. And of course, more dues-paying members. My hope is that NACCHO will continue to be a leader, partner, catalyst, and voice for local health departments, a respected and trusted advocate for them, an organization helping others appreciate the unique value added from their local health departments, and a sought-after resource for NACCHO members and NACCHO funders. I hope NACCHO will help local health departments rise to relieve the damage and mistrust created by misinformation and political extremism, which has followed the COVID pandemic. I hope NACCHO will be resilient and maintain its flexibility, creativity, and responsiveness to ever-renewing threats to population health and conditions on the ground. I hope NACCHO will remain in service to its members and partners, helping to envision and construct healthier communities and a healthier nation, prevent disease, and promote health. And I hope NACCHO will continue to offer its members what it so generously and constantly offered me: opportunities for personal growth and confidence, expanded horizons and relationships nationwide, and regularly scheduled opportunities to refresh away from my community and its day-to-day challenges, even if it is always in the months of the hottest temperatures and hottest American locations. I began working with NACCHO in 1990, served as a member and chairman of numerous NACCHO committees. I was elected to the board of directors in 1992 and regularly represented NACCHO at meetings with national organizations and federal executive branch officials. I served as NACCHO president in 2007 and 2008 and was NACCHO's third full-time executive director from 2008 until 2014. And I served actively on the Past President's Council from 2010 through 2023 when I was elected to local village office. Well, probably the most significant thing that happened was I chaired the search committee for the new executive director, and much to my surprise, following a break to consider which of the three finalists would be recommended to the NACCHO board, I was asked whether I would accept the position. Up to that point, I wasn't the candidate. NACCHO focused staff on a comprehensive membership development plan, targeting recruitment and retention. Dues-paying membership and revenue increased as one source of flexible funding. It increased other non-dues revenue through corporate sponsorships and affinity groups. It restructured meeting planning staff and attained profitability for national annual conferences for the first time. It initiated rapid response research through the Forces of Change survey to provide real-time data about local conditions annually and during emergencies. The foundation for the public's health was established within NACCHO, and NACCHO introduced its first strategic map and associated system of metrics to orient and describe NACCHO's work. It introduced organization-wide quality improvement, culture, and processes. We established the Past President's Council, the Mo Mullet Award, and created the Local Health Department of the Year Award. And we helped organize the National Public Health Accreditation Board. In addition, as I mentioned, we created an incident response team at NACCHO to respond to pandemics and other emergencies. We prepared for a potential federal government shutdown for the first time through negotiations with CDC and OSTILTS. That shutdown fortunately never happened. And we established new staff performance planning, appraisal tools, and performance-based salary administration.